Good afternoon and welcome to the state of Alice in North Carolina. Launched in 2009 with the study of financial hardship in one New Jersey county, the nonpartisan United for Alice movement has grown to include 41 states and the District of Columbia. The Alice research shines a spotlight on households facing financial hardship, their strengths, as well as the challenges they face. With data, tools, and resources, United for Alice equips community partners, including United Ways, foundations, government, corporations, and other nonprofits, to build equitable policies and programs that promote the financial stability for Alice and for all. The State of Alice in North Carolina 2026 Update on Financial Hardships is brought to you by the United Way of North Carolina. If you have questions throughout the presentation, please put them in the Q&A. We have dedicated time at the end of the presentation to answer questions. I am Brittany Pruitt-Fletcher, the President and CEO of United Way of North Carolina. It is great to see so many of our friends on the call today. You will also be hearing from our Director of Mission Advancement, Sally Gordon, and Sarah Carlson, our Mission Advancement Manager. United Way of North Carolina exists to ensure that every individual, family, and community in our state has the opportunity to thrive. While local United Ways are deeply connected to their communities, United Way of North Carolina serves as a statewide backbone that connects people, resources, data, advocacy, and partnerships across the state. Our purpose is simple but powerful: helping individuals, families, and communities thrive. We focus on addressing both immediate needs and long-term solutions that improve the quality of life and expand opportunities. Whether it's connecting someone to critical resources through NC211, supporting disaster recovery, or advancing economic mobility, our work is grounded in improving outcomes for North Carolinians. Our mission is to bridge people, local United Ways, and resources. We strengthen the impact of the entire United Way network by providing statewide leadership, shared services, capacity building, advocacy, and strategic partnerships. By working together, we accomplish more collectively than any organization can achieve alone. Our vision is thriving communities through equitable access to resources. We believe that no matter where someone lives, that should not determine the support, the access to opportunities, or the pathways to success for them. Through initiatives like NC211, ALICE, public policy advocacy, and cross-sector partnerships, we work to ensure that resources reach the people and communities that need them the most. Across North Carolina, many working families continue to struggle despite being employed. The ALICE data helps us understand these challenges and identify solutions. United Way of North Carolina is uniquely positioned to connect local insights with statewide action, creating systems-level change that improves lives in all 100 counties. Our role is to convene, align, and mobilize partners so that together we can build a stronger, more resilient North Carolina. As we move through today's presentation, you'll hear how programs, partnerships, and statewide initiatives bring the purpose, mission, and vision to life every day for communities across North Carolina. So who is ALICE? ALICE represents millions of families who are a vital part of North Carolina, but struggling to earn enough to meet their basic needs. We call these households ALICE, asset limited, income constrained, employed. ALICE households bring in income above the federal poverty level, but less than the cost of basics in the counties where they live. While ALICE households have been struggling in the shadows for far too long, the irony is we all know ALICE. In fact, we're already talking about ALICE, but many of us have used terms like the working poor, the invisible, the forgotten to describe ALICE because often we don't know what other term to use. United for Alice has given us a way to quantify the population that we are seeing and that we rely on each and every day. Alice is everywhere. Alice can be your neighbor, a friend, a family member, a colleague, anyone that participates in every corner of the community across civic, social, cultural, religious, and recreational spaces. You might know Alice from your child's soccer team, the community garden, or as a member of the place where you worship. And Alice workers typically include our childcare providers, retail salespeople, cashiers, waiters, delivery drivers, gas station attendants, and caregivers. Think for a moment about the Alice workers you've encountered just today. Maybe you dropped your kids off at the childcare center this morning. Then perhaps you filled your gas tank up before you started your workday. Maybe you went to your favorite deli for lunch, or you went to run an errand at the grocery store. There may even be an Amazon package sitting outside your door right at this very moment. Alice workers are the engine that makes our economy and our daily lives run smoothly. Yet all this time, they've been overlooked and undercounted as they live each day priced out of survival and unable to afford the basics in our state. Behind every statistic is a person, and Callie's story reminds us why financial stability work matters. Like many North Carolinians, Callie was working hard but faced challenges navigating financial decisions, building savings, and creating a path toward long-term stability. I don't think that the audio is working on the video, so we will send this out to everybody. But stories like Callie's reflect a broader challenge facing many Alice households, families who are working but still struggling to afford basic necessities. Financial literacy is a critical component of economic mobility because it equips individuals with the tools to help make informed choices, prepare for emergencies, and build long-term financial resilience. When individuals achieve greater financial stability, families are stronger, workplaces are more productive, and communities thrive. This is exactly how United Way creates impact, by connecting people with resources, opportunity, and support systems that help them move towards self-sufficiency. United Way of Burke County is helping residents build not just financial knowledge, but financial confidence and hope for the future. Callie's story is one example of how local United Ways are transforming lives every day in North Carolina, creating pathways to economic mobility and helping communities thrive. In February 2025, North Carolina officially launched its first Alice report. The effort was made possible through the investment and partnership of the Carolinas Federal Credit Union Foundation and United Way of North Carolina. Together, we recognize the need for a better understanding of financial hardship across all 100 counties. North Carolina joined 41 other states to participate in the Alice Network. By joining this initiative, we gained access to a nationally recognized methodology that allows us to measure financial hardship consistently and compare trends over time. This gives policymakers, funders, businesses, and community leaders a shared language and reliable data for decision-making. The Alice research is provided by United for Alice, a research initiative within United Way of Northern New Jersey. Their work has established a trusted framework that is now helping states across the country better understand economic realities and identify solutions. The partnership allows North Carolina to benefit from the rigorous research while focusing on local strategies and community-driven responses. The report is more than just a collection of statistics. It's a tool for action. It helps us identify where families are struggling, understanding the barriers they face, and develop solutions that create pathways to financial stability. The ALICE data is already informing conversations around workforce development, childcare, affordable housing, transportation, and financial well-being across our state. Bringing ALICE to North Carolina was an important first step. The real opportunity now is using the data to drive collaboration, shape policy, and create meaningful change for the hundreds of thousands of North Carolina households working hard but still struggling to make ends meet. So let's pull back the curtain on the true extent of hardship in our communities. Here in North Carolina, nearly 571,000 households were living in poverty in 2024. That's about 13% of our overall households. But another 1.2 million households, that's 28% or more than twice as many, were ALICE and also struggling to get by. Combined, that's more than 1.8 million households, a staggering 41% that fell below the ALICE threshold, the average income needed to live and work in today's economy. This is the reality of hardship in our state, concealed by outdated measures that have long been considered the standard. Now, Sally Gordon, our Director of Mission Advancement, will give a greater insight into the ALICE data.
Thank you, Brittany. The two pillars of the ALICE measures are household costs and income. The ALICE Household Survival Budget estimates the cost of household basics, housing, childcare, food, transportation, healthcare, technology, as well as taxes for each county in North Carolina, which is derived from a range of publicly available data sources. This is a minimal budget with no room for emergency expenses, debt payments, or savings for the future. Change over time in the cost of household basics is tracked in the ALICE Essentials Index. The core issue is the gap between household income and what families need to make ends meet. This makes it impossible for many households to attain financial stability, no matter how hard they work. The graph on this slide shows the mismatch between costs, wages, and the federal poverty level in 2024. First, it includes household survival budget costs for a North Carolina family with 2 adults, an infant, and a preschooler, totaling $79,596 annually. Second, it shows the household's combined full-time earnings with one adult in the household working as a cook and the other working as a teller, 2 common occupations in the state. That totals $70,052 annually. And finally, the federal poverty level for a family of 4 is also shown, which is $31,200, the same amount for all contiguous U.S. states. There are households below the ALICE threshold all across North Carolina, and they reflect a wide range of demographics and household types. Between 2010 and 2024, the total number of households in North Carolina increased from 3.6 million to 4.4 million. During this period, despite some ups and downs, the number of ALICE households in North Carolina trended upward, while the number of households in poverty remained largely unchanged. The number of households below the ALICE threshold has remained high over time, persisting through shifting economic conditions and the COVID-19 pandemic, and across political administrations. Between 2010 and 2024, the number of households below the threshold in North Carolina increased from 1.5 million to 1.8 million. During this period, the percentage of households below the threshold in North Carolina ranged from a high of 44% to a low of 41%. Most recently, the share of financially insecure households remained largely unchanged. Inflation is a key indicator of the health of the economy. When prices increase faster than wages and other sources of income, purchasing power decreases and households struggle to make ends meet. The Alice Essentials Index measures change over time in the cost of household essentials that matter most to Alice and poverty level households. This includes housing, childcare, food, transportation, healthcare, and basic technology necessities. The standard measure of inflation in the US, the Bureau of Labor Statistics Consumer Price Index, or CPI, tracks a much larger basket of over 200 categories of goods and services, including items that financially insecure households can't afford on a regular basis, like full service meals at restaurants, major appliances, and travel. Tracking costs over time using CPI alone can conceal important changes in the cost of household essentials. In North Carolina, the Alice Essentials Index increased faster than the national CPI, as shown in the figure on this slide. And like the national trend, essential costs in North Carolina increased at a faster rate following the pandemic. A 5.3% annual increase in the Alice Essentials Index from 2021 to 2024, compared to 2.6% between 2007 and 2019. And now I'm going to pass it to Sarah Carlson, Mission Advancement Manager, to continue sharing some data points with you.
Now let's take a look at some of the Alice demographics. Alice households span all ages, genders, races, and ethnicities, living in urban, suburban, and rural communities all around the country and all across our state. But some groups experience hardship at disproportionate rates. For example, in 2024, 41% of Black and Hispanic households in North Carolina fell below the Alice threshold compared to their Asian and Native Hawaiian and Pacific Islander counterparts at 26% and 35% respectively. This represents the various disparities of races and ethnicities across North Carolina. In 2024, 39% of single or cohabiting households without children, headed by households by member composition, someone under age 65, the most common household type, were below the Alice threshold in North Carolina. Among families with children under age 18, there were disparities in financial hardship by household type. So again, in 2024, 73% of single female-headed families and 59% of single male-headed families were below the Alice threshold, compared to 18% of married parent families. The youngest and oldest households had the highest rates of financial hardship. 69% of households were headed by someone below the age of 25, and 50% of households were headed by someone age 65 and over, lived below the Alice threshold in North Carolina. By comparison, rates were lower for those in their prime working years, with 35% living below the threshold for both households headed by people age 25 to 44 and households headed by those age 45 to 64. And then in 2024, the rate of financial hardship was higher in the predominantly rural counties of North Carolina, where 46% of all households were below the Alice threshold, compared to 40% in predominantly urban counties. There are workers below the Alice threshold all across industry sectors in North Carolina. Among the 10 largest industry sectors, as you see in this chart, the percentage of workers living in households below the Alice threshold varied from 10% in finance and insurance to 45% in accommodation and food services. This table includes wages of full-time workers residing in North Carolina with income from occupations in the listed sectors. Wages include tips, comparing workers' total household income to the Alice household survival budget for their household composition and location. Next, Sally is going to walk you through the methodology of the report.
Thank you, Sarah. Each Alice report uses a standardized set of measurements to quantify the cost of a basic household budget in each county in each state, and to show how many households are struggling to afford it. United for Alice uses the measures listed on this slide to quantify the basics cost of living, identify and assess financial hardship, identify gaps in assistance and community resources, as well as tracking change over time. The Alice Household Survival Budget is the bare minimum estimated cost of household basics needed to live and work in the current economy. The Alice 65 Plus Survival Budget adjusts the household survival budget to reflect the fact that older adults typically spend less than younger and family households on food and transportation, as older adults travel fewer miles for work and family responsibilities. The Alice Household Stability Budget provides an estimate of a budget that is sustainable over time, and as such has slightly higher standards and costs than the Household Survival Budget. The Alice threshold of financial survival represents the minimum income level necessary to afford household essentials as reported in the Household Survival Budget. And finally, the Alice Essentials Index is a state and national measure that tracks change over time in household essentials. So how do we help Alice? As we launch the 2026 Alice Report for North Carolina, we invite community leaders, advocates, partners, and all of you on this call to turn this data into action. Share the Alice story widely. Help raise awareness by sharing Alice data, findings, and real-life stories with community members, nonprofit and business partners, your staff, elected officials, and more. The more people understanding the challenges facing Alice households, the stronger our collective response can be. Partner with your local United Way. Engage with your local United Way's Alice initiatives, programs, and advocacy efforts. Together, we can use this data to identify needs, strengthen community partnerships, and support families working toward financial stability. If you have questions on who your local United Way is or finding their contact information, please let us know and we'd be happy to connect you. Advocate for sustainable solutions statewide. Support investments in policies and programs that help families move beyond financial hardship and achieve long-term stability. This includes funding and expanding proven resources that address immediate needs while creating pathways to economic mobility. Supporting critical community resources such as NC211. NC211 provides free, confidential information and referrals 24 hours a day, 7 days a week, 365 days a year, connecting residents to local services for housing, food, healthcare, childcare, and much more. Strengthening resources like NC211 help ensure families can access support when they need it most. The 2026 Alice Report is more than a set of statistics. It is a call to action. By sharing the data, partnering locally, and advocating for meaningful solutions, we can build a North Carolina where every household has the opportunity to achieve financial stability and truly thrive. We now open it up. If you have questions, feel free to put those into the Q&A function.
And I wanted to quickly introduce Ashley Englund with United for Alice, who is joining in case she can answer any questions for you as well. And Ashley, I have given you the speaking access.
Great. Thanks so much. Great to be here. Appreciate this overview and happy to answer any questions that pop up.
You're very welcome, Shelley. Thank you for joining. All right. So Maria asks, have there been any Women United fundraising launched? Not through United Way of North Carolina, but maybe Ashley, she might know about some that have been launched in other states.
Yeah, we actually do have the Women United program that we run for United Way of Northern New Jersey and actually several other states for volunteer activation. And actually, Alice has been their main kind of targeted focus for the past several years in our local geography. And we've gotten some really great skill-based volunteering and events for women related to Alice. And they've also taken a particular interest in childcare and helping make childcare more affordable in our local community.
Thank you, Ashley. And thank you for the question, Maria. All right. And then Kim is asking, can Ashley provide examples of how communities in other states have used Alice?
Yeah, so we see a lot of different initiatives because, well, financial hardship is tied to everything, right? So it's kind of the base of everything to get that financial stability. But a lot of our partners use the data for, first of all, just assessing the need in their communities, understanding where Alice is, what populations and demographics. Our data, while we have county and state level data, does also go down to zip code and place and town. So a lot of times finding out where those places are that you might see higher financial hardship. And then that information can be used in a lot of different ways. So our partners are using that in grant writing. They're using it to help develop programs that specifically target the needs of Alice households. For example, our community college partners have been working to better understand the needs of working students and how that might differ from, traditional college students, how they can make different course offerings available and different financial aid and assistance packages. We have a lot of our partners working with employers as well, because we know that sometimes the big policy changes might take a while, but companies can change a lot of their policies more simply or quickly to help Alice workers. So, better understanding shifts and wages, understanding the needs of different workers. We have an Alice at Work program that helps train executives and HR professionals to kind of make best practices that help Alice households. Yeah, it's targeted childcare initiatives. In New Jersey, we're making childcare more affordable by providing additional scholarships beyond what the state stipends pay, because we know there's need above that federal poverty level. Trying to think, there's lots of great examples. Some of our foundation partners work together in Arkansas to help erase medical debt for Alice households, making a huge difference and lifting a big burden. Yeah, so lots of different areas. If you name the area, there's probably something going on. We have a really great database on our website, unitedforalice.org/alice-in-action. And we have over 250 different examples of how our partners are plugging in that data. But I mean, that's the main point of this, right? Is to get the data in the hands of all of you who are doing that work on the ground. And just, yeah, a big thanks to all of you in doing that in North Carolina.
Thank you, Ashley. All right. And then Kit is asking, has the Alice website been updated so we can check out our county's 2026 information? Yes, it has. And if you are a local United Way of the state of North Carolina on this call, your county's data is already in the asset library. And I'm happy to email out a link to that. But for those of you who are not local United Ways, you are welcome to go to unitedforalice.org, and then I believe it's /North Carolina. And there is a section on there in the tab that says County Reports, and then you can just choose which county you want to see, and it'll automatically show on the page. All right, and then Carlos is asking, how are Alice families identified to join or benefit from programs by local United Way supported agencies? So I would say that, so in the instance of Cali, and again to everyone, I'm so sorry the video didn't work. We thought it worked in our practice round. I guess it didn't, but we will be giving you the video. But Cali came through Burke County United Way through one of their direct programs. She was doing some training on budgeting and financial skills, and they just already knew about her situation. They already knew about how much she was making, about her being a single mom, and she's, in the process of going back to school. So they already Burke County United Way already knew about her situation, already knew her as a client of one of their programs. So they referred her to me when I was reaching out, gathering Alice stories. So that's definitely one way that, you can reach out to your, um, if you own your own program, reaching out to your own clients, or if you have partner agencies, speaking with them and see if their clients would be willing to speak up about their Alice story.
And Sarah, I'll also just add some of our local United Ways and nonprofit organizations have shifted certain income requirements or broadened some of their requirements for their programs to be more encompassing of Alice, apologies. Because we know sometimes folks, even just a little bit above the federal poverty line, our Alice folks are still very much struggling. So based on this Alice framework and data and information that we now have, some organizations are shifting who they accept their income requirements and so on.
Yeah, and I'll just add to help make that an easier process. We actually have a tool as well called the income status tool. If you're curious, am I Alice? Are the people that I'm serving in this program Alice? You can use that tool to put in your state and then county or just state level, and then the income and household composition. So you can put in the number of children, the number of adults, and how much that household is making either monthly or annually. And it'll give you the budget and tell you, is that household poverty level, Alice, or above the Alice threshold? So some folks are using that as their eligibility kind of tracker. Others are using that to kind of share and get out the word to better understand who is Alice, and again, to see if your household is.
Awesome. All right, next question from Judith. Can we get a copy of the statistics in the slide deck? Yes, we will be sending out this recording of the webinar. We'll be sending out a PDF of the slides, and you can find the direct statistics from the State of Alice report that can be found on unitedwaync.org and unitedforalice.org/North Carolina. All right, and then Linda is asking, where is the Alice data taken from? From US Census reports, etc.? Ashley, I'll let you answer that one.
Sure. Yeah. So the household survival budget, first of all, those different like housing, childcare, food, each of those come from different publicly available data sources that are available at the county level for all counties in the US. So for example, housing is fair market rent from the US Department of Housing and Urban Development. Food is the Thrifty Food Plan from USDA. So we look and source those for every county in the US, and then we adjust those for all different household compositions and combinations. So that's where the cost side of things come from. That's in that budget. And then the other part of it, the equation has household income. And so that comes from the American Community Survey from the US Census Bureau. And we use that data to compare household income to cost to see if they're above or below that Alice threshold.
And Ashley, no one has written it down in the Q&A, but I personally get a lot of questions about, well, why is the data 2 years behind in the latest report?
Yeah, that's our main source being the American Community Survey. It has that lag. So we usually get the data and kind of in that 2 year lag, we get it and then produce it the next available year. So there's always that little lag built into the census, mostly because the American Community Survey is such a giant survey and instrument. It takes the Census Bureau a little while to release it. So right now, the latest data is 2024. And it came out at the very kind of beginning of this year. And we produce our updates in the spring annually. So you'll get those annual updates, but there's always going to be that lag. With our Alice Essentials Index, when we're looking at cost, there's some things we can look ahead in the budget. And so you'll note there's like a dotted line on that one to show a projection out to 2026. But to get those population estimates, to know how many households and what geographies, who's struggling, we rely on the census data. So we have to wait.
Thank you. And then we got one more question in the queue right now. Jackie asks, is there one area that is more of a hardship for Alice families, like food, health, transportation, etc.?
It depends
And
on the age and the composition of families, I'll just say, but generally housing and childcare are the biggest drivers of cost and are kind of the more rapidly increasing as well. And we see that in the state and nationally. Um, if you have a household with two or more children, usually childcare is more expensive than even housing. So that's something that we definitely flag.
awesome. Thank you.
Yeah.
All right. Well, that is it for the question queue so far. If anyone has any questions that have popped up while we've been talking, you are more than welcome to put them in here. And maybe we can give people like a minute to see if anything pops in, and then we will move on otherwise. But Maria, I did read your comment about how you resided in New Jersey when the Alice reports were launched and was part of the United Way of Northern New Jersey, and how you guys launched Women United. That's very cool that you got to witness the start of that and remember that.
Yeah, history in the room. Hey, Maria, that's great.
All right. All right. You guys are welcome. Okay, well, it doesn't seem like any other questions are coming in right now. But you are more than welcome to reach out to us in the future, which we will get to in a second. So I'm gonna move us along. So we do have a heavy presence online on social media. I welcome you to scan that QR code with your phone. It is going to take you to our link tree with all of our social media pages and our two websites, because you may or may not know that United Way of North Carolina also works with local United Ways to power the program NC211. So we've got a website for nc211.org and then our website, unitedwaync.org. And then we are on X, Facebook, Instagram, LinkedIn, YouTube, TikTok. So by following us, you're going to get some updates about our various health and human service programs. You're going to see what local United Ways across the state are doing for your communities and staying up to date on disaster response, because we are a member of the state emergency response team, and so much more. So be sure to give us a follow and share with your friends and colleagues. And then I will turn it over to Brittany to wrap up.
Thank you so much for taking time out of your days to learn more about this population of North Carolinians and how you can advocate and provide support. Feel free to keep in touch with us. The webinar was recorded and we'll be posting it on unitedwaync.org, and we'll be emailing it out to everyone who attended. You are welcome to share the recording with your contacts as well. We just appreciate your time today, and we hope you all have a wonderful day.